May I have my slides, please? Morning, everybody. There, I am in business. I am Dr. Ed YAGER. I am a psychologist from San Diego, California, where I hold an appointment as clinical professor of psychiatry there in the UCSD School of Medicine. If you want to know anything about anything else about me, please approach me after the presentation. This morning I want to speak to you about treating chronic pain with this method that I call subliminal therapy. Now, I want to begin with talking about pain. You know, pain is a kind of a great experience if you back off and think about it. We got to have it. It's essential for life. We would do all manner of things that would put us in jeopardy were it not for pain. And yet, when that pain has served its purpose, when it's gotten our attention, we've gone to the dentist, we have seen the doctor, we have done whatever we know to do, well, at that point in time, the pain lacks purpose. There's no reason for it. And turns out we have the mental capacity to not perceive it. We all have that capacity. You see it demonstrated in many spontaneous situations, little ones like your own personal experience of maybe cutting a finger, and the first thing you know about it, there's blood every place. And you have to stop and look. Well, if you compare that experience to taking a knife and cutting it, totally different experience. It's about a perception. It's all about perception. And perception, you see, is an intellectual process. It's not our senses. Perception of the pain is an intellectual process over which we have some level of control, if we know how. Yeah, pain is necessary, but in a very high percentage of the cases, chronic pain is not necessary. It's no longer serving any purpose. It's a conditioned reflex. In a sense, it's serving a subconscious purpose. And it happens through this phenomena called conditioning. We are conditioned by the experiences we have in life. Now, no intelligent person would deny that. But if you dig deeper, you find the extent and the severity, the significance of conditioning to be very attention-getting. I have been developing and using this method, doing research on it, this method that I call subliminal therapy, for just about 40 years. 40 years. Well, what I've learned has to do with conditioning. We are conditioned by the experiences, and we are not consciously aware that we are being conditioned by the experience. We're only aware of the experience. Dog bites child. Child instantly is conditioned to be afraid of dogs, but the child is only aware of the experience. Well, in like form, we can learn to take advantage, even without conscious awareness, take advantage of the experiences we have in life. We can learn all manner of lessons from the experiences we have in life. We can learn. We're very adaptive creatures, actually. And that adaptive process is not a conscious, intellectual, cognitive, rational reasoning. It happens without conscious awareness. We all know, I'm sure most, maybe all, know someone who is experiencing chronic pain, and there is no physiological basis for it. It's not being stimulated. You know, some pain problems are constantly being re-stimulated. Some cases of terminal cancer, that applies. Some cases of oral problems, that applies. There are specific conditions where the actual stimulus of the pain is physiologically based and is repetitive, perhaps constant. But most cases of chronic pain, that's not present. There is no physical basis for the pain to be there at all. So these people who are experiencing chronic pain, maybe low back pain, foot pain for some reason is a very popular one in my practice. There's no basis for that. It's serving some psychological purpose. Well, in the case of elderly people, commonly that purpose is to get attention. Get attention. That's so important to us. When you're old and isolated, that's the only way you have to get attention. It's not being done consciously, but that subconscious motivation is present. It's real. The pain is real also. All pain is real to the person experiencing it. This is a list of subconscious reasons that I have that have been reported to me by my patients when they have engaged this process that I call subliminal therapy. Subliminal therapy is a means of uncovering those causes, those subconscious reasons, those conditioned reflexes, if you want to talk about it that way, that are prompting the continuation of the pain, or the addiction, or the behavioral problem, or whatever it is. It's all about conditioning. The third one, to know I'm alive. I treated a patient with almost verbatim the same history and resolution that I read about in another article. I haven't been able to find the other article again. It was a condition where the person my patient was presenting with chronic pain, severe, higher back pain in his case. And no medical basis. Well, using subliminal therapy, was able to go back to the initial situation. This is a kind of a hypnotic process, but this process is dramatically different from anything normally considered hypnotic. But he was able to identify, to pull up the memory of that experience that initiated this pain. And that experience involved him lying out on the street, injured, had a back injury. He was injured, had been in an automobile accident. And the EMT, the medical attendant, driving the ambulance, came up to him. Now, in that situation, emotion is at its peak. Well, those of you who have any knowledge of hypnosis and hypnotic phenomena know that at intense emotion experiences, that's when we are extremely suggestible in some cases. So one could explain this as a hypnotic experience involving suggestion. In this case, it was implied. This attendant came up to this man, terrified, and the attendant said, "As long as you are in pain, you will know you are alive." Wow, what a profound suggestion to keep having pain, huh? So, subliminal therapy, very brief therapy, psychodynamically based. You look for the cause, you resolve it at the causal level, the symptom ceases to exist. This method has some real advantages. The efficiency is achieved by engaging a level of intellectual functioning that most people don't know we have, but that we all have. The extra conscious, higher intelligent level of our minds. It's based on the two assumptions. First, we are conditioned creatures. If the presenting problem is the consequence of some earlier experience, in other words, if it is psychogenic, this is the preferred method to treat this with. The other assumption, we all have this higher level of intelligence into which we can tap to solve all manner of problems. In execution, the clinician guides the process, but the patient does all of the work. Now, the method is very different from other methods. And one of the primary differences is that as the clinician, I hope you guys take my workshop. It starts tomorrow afternoon. As the clinician, you are remarkably uninvolved in the course of the work being done. Now, we're trained to be involved. We're trained to get the information, help the patient deal with it. Well, the problem is, in conventional therapies, the problem is that the patient doesn't know why they have the problem they've brought in the door. If they knew why, they would have fixed it. They wouldn't even be there. You have to uncover that subconscious cause and resolve it at that level. So, all of that work, you see, is accomplished by that higher level of intelligence that the patient has. Even the patient, in some situations, is blind to what is going on at that higher level. The advantages, the characteristics of this are really advantages. In any psychotherapy, one of the key issues is we somehow have to bypass, get around, deal with conscious resistance and opinions and biases, beliefs that get in the way of the real work. Well, this method is remarkably effective in doing exactly that. The other big feature, it avoids clinician bias because the clinician is so divorced from the actual work. if we have impressions or opinions about things, which we do every time we see a patient, we do, well, maybe our bias doesn't belong. Maybe it shouldn't even be considered. So this method protects the patient from clinician bias. And in using this method, we don't really talk about making things better. Success is defined as there is no symptoms remaining. No more headaches, no more behavioral problems, whatever it is. It's not making it better. Well, in the case of chronic pain, that still applies. Not easing it, eliminating it. Now this 2-day course begins tomorrow at 3 o'clock. If you want more information on this method, go to that website. And if you want an interesting adventure, click on my picture there on that website. Now somewhere here I'm missing, there it is. Now, these are out of my practice. These numbers are not out of my head. These numbers are derived from patient-completed inventories. Now, this is not a controlled study. Nevertheless, the data is valid. I ask my patients to complete these inventories before treatment, after treatment, and at follow-up sometime later, whenever that's possible. These are the success rates obtained with the different physical pain problem. So, you have any questions for me? I've said everything you want to hear. The man with the microphone is coming to you. Oh, yes, sir.
I guess I'm going first. I have a question. For how long is the success maintained? You know, I could see how a patient would be very relieved to have acquired an insight, but that they would slip back into dysfunctional patterns after a few months.
Thank you for that question. The answer is you can always break your leg again. But until you do, there's no more pain. By spelling success, it means cure. Now, the medical world doesn't like that word. And I fully understand why. It's not even approved generally in psychology. But with this method, when you have completed the work, the odds are very high. It's over. It's over. Those subconscious influences that have been propelling the smoking or the headaches or whatever are not there. Now, can they be generated again? Sure, by another life experience. But as far as the present issue is concerned, it's gone.
Hello.
Hi.
I guess my question is.
The mic's not on.
Hello?
Yes.
Okay. How does this method apply to psychological pain? For example, pain caused by a painful memory or a traumatic memory.
Wow. I think I could easily consume the rest of the afternoon answering that question. point in my life, my first career, first many years, was as an engineer. The study of hypnosis led me out of that world into our world. I have been teaching a course in the clinical use of hypnosis at the medical school now for 41 years. I don't know how to digest all this into a simple answer, but I say this to you. I say this to you whether you are a physician or a psychologist. If you don't understand hypnotic phenomena, you gotta go back. It's too important. Hypnotic elements are a natural part of life. We spontaneously experience what we call trance thousands and thousands of times in life. This isn't nothing weird and new. This is life. Well, when you understand hypnotic phenomena, you understand. You get some insights about how and when and where we are more suggestible. And then you're able to take advantage of this in your clinical practice. Now, for the physician, the primary use of hypnotic phenomena is as a suggestive vehicle. Doesn't need to last a lifetime. Needs only long enough for me to do this procedure with the patient in comfort. You know, we can and do serious abdominal surgeries using hypnosis as the sole anesthetic. Some people can't tolerate the chemicals. So what are they going to do? Well, as psychologists, we're more apt to use this phenomena as an analytical tool to uncover cause. It works, but subliminal therapy works far better.
I read in one of the abstracts that you can also use it when a person is addicted to another person.
My old ears don't work very well.
She said that you wrote that abstract that this therapy can use it in addiction from one person to another. Addiction doesn't mean you are stick to a person and you can, I would say obsession is more like a personal obsession to another.
Let me summarize my answer this way. If the obsession is a consequence of conditioning from some earlier experience, it can be addressed, it can be treated by hypnotic methods, not as efficient time-wise. This subliminal therapy is the briefest of brief therapies. It's rare that I see any patient more than half a dozen sessions, even though they have presented multiple problems. Okay, it's time for me to turn this microphone over to the next speaker.